So before we get started, what I'd like to do is just ask the people who will be presenting today to do a quick introduction of themselves. I'll start with Brandon.
Thanks, Lynell. Hi, everyone. My name is Brandon Karisu. I'm the president of AIO Digital, and we assisted with the development and rollout of the AlohaSafe alert application.
Thank you, Brandon. How about Josh?
Good morning, everyone. Our name is Joshua Quint. As the DOH lead for this exposure notifications initiative, my role has been to provide the epidemiological expertise to the AlohaSafe team and figuring out how we can integrate this technology into our existing traditional manual contact tracing approach. And a little bit quick background for me, I have 4 years working in applied epi in the disease outbreak control division at the health department. And then I have my graduate training with an MPH and doctorate in epidemiology from UCLA. Glad to be here. Thanks.
Thank you, Josh. Michael?
Hi, I'm Michael. I'm an engineer at a software company called Nuix, and I sort of got involved here because I wanted to make sure that we could help the Department of Health do contact tracing effectively without sacrificing privacy. So that's it for me.
Thank you, Michael. We're also very privileged to have Scott Becker with us today. Scott?
Aloha, everyone. I'm Scott Becker. I'm the Chief Executive Officer of the Association of Public Health Laboratories, and our role is to host the National Key Server and the Multi-Tenant Verification Server, and it's our pleasure to work with both the Hawaii Department of Health and the Hawaii Executive Collaboration.
Thank you so much, Scott. So we'll just dive in to the presentation that we have for you. We'll just start off with wanted to highlight a few key points about AlohaSafe Alert. This app is really developed through a public-private partnership. It is really an effort, a lot of volunteers, a lot of people who have volunteered time and resources to pull this app together. And as Dr. Char, what you've often heard her, or she often has said, is this has been developed by the community and for the community, because this will only be as effective as our community members download it and adopt it. The other piece is privacy is priority. So as you learn and as we walk through this app, you'll see that it doesn't track any sort of location, doesn't give any sort of identifiable pieces to a person. So that was really key in making sure that this technology, and as AlohaSafe Alert adopted it and the state adopted it, that was a top priority. This app isn't meant to be the silver bullet, but instead it's meant to be another tool added on as another layer of safety that will help make contact tracing and diagnosis and everything more efficient and effective. And again, you'll hear more about that as we go on. Next slide, please. More than 20 states and a lot of other countries have adopted this app. And the advantage to that is that we're learning a lot from them. We've come in, I think, at a really good time. Not only timing with as vaccines slowly roll out, we don't want people to get too comfortable. We want them to be able to stay vigilant and then also to be able to help control the spread. Learning from what other states have done and introducing this app at a time that we are is I think a really good thing for us. The way we're trying to measure success for the app is around 3 main things that you see on that slide. It's downloads, it's the codes issued and claimed, and it's the engagement. So around downloads, studies out of Oxford have shown that if just 15% of the population adopts the app, that it could prevent 8% of, or decrease the infection rate by 8% and decrease deaths by 6%. So if we can get that done, just 15%, which would equal to about 150,000 people based on the number of cell phone users across the state, that I think is a really doable goal. And so that's what we're trying to get to at minimum. The other is the codes issued. So what you'll learn is that DOH issues a code, and it's really in the power of the user's hands to be able to claim that code so that it can send out alerts to everyone else. So that's another thing that we'll really be focusing on, is getting people to want to engage and use that code to help protect their community. And that rate on average is about a 5% claim rate. And then finally, engagement. We have toolkits on our website, AlohaSafeAlert.org, and that will be a way that we're trying to include and engage the community to get adoption. And we'll share a little more detail of that later. So far, we've had successful pilots in Maui County, and Hawaii County just launched it on December 30th. To date, we have over 13,000 downloads, 235 codes were issued, and 8 were claimed. So those are some key points and highlights, and I'd now like to turn it over to Brandon, who will start walking us through what this app really does.
Hey, thanks, Linnell. So just a quick overview, but in the beginning of the pandemic, Google and Apple, they came together, they joined forces and created this technology that will notify you if you've been exposed to someone that tested positive for COVID-19. This technology is called GAIN, and it's an acronym that stands for Google Apple Exposure Notification. The GAIN protocol, it's already embedded in the operating system of your Apple or Android device. It was included in one of the software updates probably a few months ago. And the AlohaSafe Alert app is what activates this GAIN protocol on your device. The technology uses low energy Bluetooth to anonymously communicate with other devices around you that also have the app installed. Next slide, please. So as it's communicating with these other devices, it's also measuring the exposure between these devices. And what it's doing is it's sending random gibberish codes back and forth. And in doing so, it's measuring the following. It's measuring the strength of the Bluetooth signal, which infers how far apart we are and how unobstructed our interaction is. So, is there a wall in between us, or are we fully exposed? It also measures the duration of our interaction, as well as the date and time of this interaction. Next slide, please. So here's an example. I go to a small get-together. There's 4 people there, and 3 of us have the AlohaSafe Alert app installed on our phones. We're all sitting, close to each other in a circle, talking story. And while we're doing that, our apps in the background are communicating, and it's sending those random gibberish codes to each other, measuring our exposure. Next slide, please. So say, the next day, I'm not feeling well. I go and get tested. Turns out I'm positive. Next slide. Everyone at that get-together, if they meet the minimum exposure criteria, which is 6 feet or less, 15 minutes cumulative within the last 14 days, they would receive a notification on their device saying that they may have been exposed to COVID-19. And as you can see, the person that didn't have the AlohaSafe Alert app installed would not get a notification. So this alert it's similar to a news or weather alert that you would receive on your phone. And the alert is completely anonymous. So it won't say who may have exposed you or where you may have been exposed. It just says that you may have been exposed to someone that tested positive for COVID-19. So now rather than being out and about, they can self-quarantine, get tested, or seek other guidance from their primary care physician. And it's also important to note that the Hawaii Department of Health is the only entity in Hawaii that Google and Apple has allowed to use this GAIN protocol. And the AlohaSafe Alert app is the only app in Hawaii designated by the Department of Health to use this technology. So that concludes my portion. And next, we're very pleased to have Scott Becker, CEO from the Association of Public Health Laboratories, APHL, who will be talking about the interoperability of the AlohaSafe Alert app with apps from other states.
Great. Thank you, Brandon. Again, thanks for the opportunity to participate. I'm very excited about this for a number of reasons. And principal among that is the fact that the app is interoperable with the other states that are participating in this effort. The importance of the interoperability, honestly, is because we all want travel to happen. We all want to be safe. We want our economies to open. And picture the time when more and more visitors will come to the islands, and not just for your own community, but for the communities they come from and where they're going back to. I think it's a really important thing to recognize how the process got started. It was Google and Apple that developed the API, and they came to APHL, and the CDC is working with us as well. And we all discussed what is the best approach to do this. And the idea was that there is a national key server so that, one, every state doesn't have to set up their own server. And states also don't have to do as much of the legwork on the technical side, so they can spend the time thinking about what's important to their community. We work with the states on the technical aspects so that these keys can be exchanged on an ongoing basis, as was described. But we're also working with all of the states listed here. There are additional states that are coming on, and the reason why the map, I'm not disclosing what those are, is because we want those states to have that opportunity in their own communities. But suffice it to say, there are more states coming on. I want to see the time when this entire map is colored in gold, because that means we will be interoperable as a nation. And we have a really, really good start. I think it's a critically important thing, especially for a state like Hawaii, with your geographic location, with your travelers, and with the care you have for your own community. And I think I'd also like to just add that I pushed my vacation to Hawaii back. And now that I know this is here, this is going to be one more thing that's going to allow me to get to visit you in person. So thank you.
You can go to the next slide. And so I'm going to talk a little bit about what the onboarding process is. So these are the screens that you'll see after you download the app and first install it. And it just sort of walks you through what the app is doing. So it'll say, welcome to AlohaSafe Alert. It thanks you for doing it, tells you that this is going to help slow the spread of COVID-19. And then, as Brandon said, this works by remembering the other devices that it met, but it does it in a private and non-identifiable way. And then if you are exposed, the app is going to let you know that you may have been exposed to COVID-19. So if you can advance. So this is also on the onboarding. This is how we protect your privacy. So when you turn on exposure notifications, your phone is going to be exchanging those random identifiable gibberish keys, essentially. And because those keys are changing frequently, they're not going to be linked back to an individual. The phones are going to be swapping these keys. And then once someone is diagnosed positive, they are going to upload all of the keys that they had broadcasted to the APHL's national key server. And then that is going to allow anyone in the states that came into contact with those people to get that notification that they may have been exposed. So you can advance, please. And so once you go on, these are the permissions that you'll need to activate. So you'll need to activate exposure notifications. And then you also will probably want to enable notifications so that in the event that you do have a exposure, your phone will give you that notification. And Bluetooth is required to be on for this key exchange. Next slide, please. And that's really all that you need to do in order to get setup complete. And yeah, you can move on to the next slide. So once you've got the app running, ideally it just runs in the background. It's built into the operating system and it's using low energy Bluetooth. So there isn't going to be a huge battery drain, and hopefully this just runs in your pocket in the background and you never need to look at it. If you do want to look at it, there are a couple of things that you can see. So on the dashboard, there is a stats that we're getting from the Hawaii Department of Health. It's going to tell you, what the COVID activity is in Hawaii. And then you can press the button to report a positive test in the event that you do test positive. And then next slide, and then Josh is going to discuss the verification process.
Great, thanks, Michael. Yeah, before I jump into that, I do want to take just a quick moment to express, as a representative of the Department of Health, just my appreciation for the AlohaSafe team here, and just highlight the collaborative nature of this whole project. They have all been so patient in working with the Department of Health, and things in government can move slowly, and just have appreciated them. But they've also been very open to the feedback that we've given, and been very adaptable and willing to modify what their preconceived notions and just get on the same page with the Department of Health. So, and also just to make clear, this is a DOH-owned app, so it's Department of Health that makes the final decisions, but we definitely rely very heavily on the AlohaSafe team because we're not in the business of building apps usually at Department of Health, so they've been really amazing. And also wanted to, in the spirit of collaboration, just thank Mr. Becker for joining us. It's really an honor to have you with us, and have appreciated your leadership at APHL. This has been such a monumental undertaking, and the states rely heavily on our federal national partners. So thank you so much. So yeah, as Linnell mentioned, this digital exposure notification does not replace traditional contact tracing, but it really complements or supplements those activities. So they will continue, and we're looking at this as something that layers on. So one of my priorities have been trying to understand how can we leverage this new tool to simultaneously reduce the burden on our staff who have been working so hard around the clock for many months, and increase the overall effectiveness of the response. And that's not an easy task. So the exposure notification process that is performed digitally mirrors what we've been doing manually with these 4 key steps. There's diagnosis, verify, notify, and quarantine. So I'll just kind of read through that whole process, and so you can get a sense of how this works. So step 1 that has to happen is we need users adopting, downloading the app. And then that way that if and when a few days or weeks later, those people who have downloaded the app do test positive for COVID-19, we hope they don't, but if they do, then they get confirmed positive. Now, because Department of Health considers COVID-19 as an urgently mandatory reportable condition, then we have a list of all new cases in the state. And we've taken the approach of sending a text message to the phone numbers attached to those new cases. And I'll talk a little bit more about that later. But that text message will read, anonymously share your COVID-19 results to AlohaSafe and help your community. There will be a individualized unique URL and quote there mentioning that the source is from the Hawaii Department of Health. So that will trigger the patient being asked to provide their consent to submit their anonymous keys into the national server. And then within 48 hours, but usually much quicker, any exposures that do fit the minimum criteria over the past 14 days, those people that also are running the app would receive a notification that they may have been exposed. So then the great thing about that is notification recipients can now self-quarantine and or get tested a lot earlier than they might otherwise have. And this app also, it doesn't just stop there. It provides guidance, generalized and customized guidance for what to watch for, and links to resources. So for most users, most of the time the app's running quietly in the background, exchanging those anonymous identifiers with the low energy Bluetooth, so it's not draining battery, and it's pinging the national server to see if the identifiers that are being stored on the phone might belong to anyone who has subsequently tested positive and was infectious while they were in contact. So the process that would ultimately produce an exposure notification begins with the first app user that tests positive for the virus. Since COVID-19, as I mentioned, is urgently reportable, we get that list. And then one challenge that a lot of the early adopting states faced was how can they integrate this step, because DOH is a critical piece. We don't want users to submit diagnoses that are fraudulent, people pranking the system, or even making accidents. So we want that gatekeeping mechanism so that only true cases are generating exposure notifications. But how do we integrate that into our systems without, as I mentioned earlier, burdening our staff? So the key innovation that was just developed in the last month or two came out of Colorado and has since been followed and adopted by the entire state of California, is this idea of automating the verification process. So the way we do this is we proactively send a short message code, text message, to all newly diagnosed cases. And the rationale here is that we don't want Department of Health investigator staff becoming a bottleneck in the process. As many states have seen, cases can surge exponentially in the matter of days and weeks. And it's very difficult to scale up human resources that quickly, the training that goes into that. And so that's a real benefit of this tool, is that it's very scalable depending on whatever the disease activity is at the time. So the Department of Health will send an automated text message to every newly diagnosed case in the state. That message doesn't contain personal identifiers. It doesn't say what their name is, but it does contain a unique secure link that is specific to that phone number, and the user can enter their diagnosis into the national key server through that mechanism. So very streamlined, very efficient, very quick. And it's important to note that consent plays in a major role here. So it's still up to the infected app user to submit their diagnosis and allow their close contacts to be anonymously notified. So that's why you'll see on panel 3 there, it's sort of explaining why you should want to share your diagnosis in advance. One other great feature that we love about this app is the ability to provide this generalized and customizable guidance to people when they receive their exposure notification. So we realized that getting this kind of notification, as Brandon mentioned, it's kind of like getting a weather alert, but it might be a little bit anxiety inducing, and people may have a lot of questions at that point in time. And so we want to connect them and direct them to very particular specific resources that are going to be relevant and anticipate a lot of those questions. So there's a number of actions that might be, oh, I'm sorry, I jumped ahead, but this slide as well is describing, you can go back one real quick. So there is the function to enter a manual verification code, but we're really hoping that this automated process will take care of this, and that we won't have people overwhelming our phone lines requesting codes, because we've already proactively pushed them out. But there is this kind of fail-safe mechanism that is available to do manual one-by-one code delivery. Thanks. You can go to the next. So yeah, as I was describing, there's actions that depend on the circumstances. So rather than directing an exposed individual directly to the doctor's office or the health department immediately, we want to see if we can meet their needs and answer their questions through this digital tool first. And the user so they're directed to monitor for their symptoms and seek medical care if they begin to feel ill. The best medical advice will always come from a medical provider, a clinical provider. The Department of Health gives general health recommendations, and we always encourage people who are feeling sick or who have health concerns to contact a professional medical provider. And so these are just tools, though, to help fill in some of the gap. We know that people are turning to a lot of different sources out there, like social media, to get their information, and we want to fill some of that information gap with trusted information. So there's a range of customized guidances that you can get depending on the response that the user enters at this point. So they can go through the symptom checker screens, and we've pulled out a couple examples. So you can see in this one, depending on what they've answered, the final screen might have this generalized guidance, which is stay home, only leave to get medical care. For anyone who's considered exposed, they should be subject to self-quarantine, and so that would apply to everyone. Don't go to work, don't use public transit or ride sharing, and then following up, if you think it's a medical emergency, then seek medical care. Next slide. And then the image on the left is sort of the default view. If you've not registered any exposures on your phone, then follow the routine standardized guidance, and we just have those reminders there. And so this app does not replace doing those things. It's definitely in addition to. And then on the right, if you do receive a notification, this is the screen you'll see, and you can personalize guidance, and it can also link out to county-specific websites that link people to COVID resources that are localized for their community. And with that, I'll hand it off to Linnell to finish the presentation, but I definitely look forward to taking questions at the end. Thank you.
Thank you. Thank you so much, Josh. Just a couple more minutes of your time because we really want to spend the majority or the rest of the time on your questions. A timeline around how this app got introduced. Brandon and the incredible team you just heard from has been working on this together since June. I represent the Hawaii Executive Collaborative, and we've been assisting with outreach and that community engagement piece as part of the team. And we've been doing a lot of outreach to different organizations. As a result, the pilots happened on Lanai and in Hana, then in all of Maui County, and then Hawaii County on December 30th. And we're super excited about the statewide launch, which then includes all of Honolulu and then Kauai as well. Mayor Kawakami will be introducing it directly to his island this afternoon. So that's the overall timeline. And next slide. Again, this is really only going to be as successful as our community members and our residents download the app. So a huge piece of this is the community engagement, and we feel that each of you here on this call are a key piece of it. So we appreciate you taking the time to do that. I also would be remiss if I didn't just quickly highlight or point out and introduce the rest of the team. We have Rachel Wong from One Shared Future, who's really helped us along the way to move this ahead and work with DOH as well. So thank you, Rachel. We also have Nicole Velasco, who represents everyone. She's on the call as well and has really been helping with there'll be a social media campaign that rolls out with this too. And then Lori Taranishi and Lynn Miyahiro from IQ360, who I know all of you know really well. In addition to that, all of the mayor and county offices have been very supportive, and we've worked closely with all of them for the rollout of the app. The legislators, House and Senate, Representative Ichiyama, who you'll see a quote from her in the release that you'll get right after this, and the House Select Committee, and then businesses, membership groups, everything from Chamber to HBR are all on board with this as well. And the unions, we've met with HSTA, HGEA, UPW, and a few others who are also encouraging their members to download the app in University of Hawaii. So one last thing I do want to share is that we did present to the PNAG physicians group. Dr. Chop really wanted to join us today. He couldn't, but he has been a big supporter of the app. And we just want to share with you how it's helping him in his practice.
As a pediatrician, in the last week or two, we have been getting daily phone calls about patients and families concerned about a possible exposure to COVID-19. And it then takes me quite a bit of time to understand whether they've had a real exposure or not. Now, if the patients had the AlohaSafe Alert app on their phone and received a notification that an exposure, that would actually help me to understand how much we should work to make sure that this patient stays safe.